Good afternoon and welcome to this seminar in which I will be presenting the results from the solid fuel and carbon monoxide review that has been performed. So my name is Dr James Hanlon from the Institute of Occupational Medicine in Edinburgh, and the project team for this project involved myself and my colleagues Alice Smith and Ken Dixon from the Institute of Occupational Medicine. I'd first of all like to thank the CO Research Trust for funding this work, and for you, the audience, for allowing me the chance to present my work to you. So in terms of the overview of the presentation, I will first of all present just a brief background to the project. I will then discuss the methodology we used for the project. So this involved a combination of literature review, FOIs, stakeholder engagement, and a gap analysis. I will then discuss the results for the regulatory and policy landscape for solid fuels, and then I will then discuss the current state of play regarding the incident data for solid fuels and carbon monoxide. I will then discuss the results for the stakeholder engagement, which was performed as part of this project. I will then briefly discuss the gap analysis results for solid fuels in terms of the regulatory and policy landscape and the incident data. I will then talk about the key conclusions from the studies and future work. This will be followed by the end by your opportunity to ask me any questions you have on the work. So in terms of the background to the project, so we at IOM performed a review of solid fuel and carbon monoxide in UK homes. This was to establish if there was an elevated risk from the use of solid fuel appliances to CO, and which are the barriers for getting accurate incident data for CO and solid fuel. So we divided this up into a number of key objectives. So the first objective was to gain an appreciation of the number of solid fuel carbon monoxide poisoning incidences and to identify the potential levels of underreporting for the number of incidences. We then wanted to understand what were the barriers for obtaining accurate incident data for CO from solid fuel appliances, and then to begin to quantify the level of risks of carbon monoxide exposure from the use of solid fuel in the home. We then also wanted to identify any issues or risks which are associated with solid fuel appliances. So this involves the installation of the appliances, the maintenance of the appliances, and the use of the appliances by the consumer. And finally, we wanted to identify any future research opportunities and research work which could follow on from this work. So the project was performed between January and June 2021, and the focus of the seminar will be focused on the incident data for CO and solid fuel. The report for this project will be available after this seminar on the CO Research Trust webinar. And if you have any questions on the project after reading the report, feel free to email me with any of your questions. So for the methodology, for reviewing the current available incident data, we used publicly available information we could find, such as government authorities, the CO and Gas Safety Society website. We reviewed the peer-reviewed literature, so this involved developing search terms in PubMed and Web of Science, and seeing if there was any peer-reviewed articles on the number of incidences from solid fuel. And we also performed freedom of information requests. So this involved taking some freedom of information requests that had been previously performed, which was kindly supplied by the CO Research Trust, and essentially taking this a step further. So for this, we performed a number of new FOI requests to the emergency services, that's the police, the ambulance services, and the fire and rescue services, and also to healthcare providers to see what data they had on carbon monoxide and solid fuel. For the review of the current regulatory and policy landscape, we looked at relevant authority and organisation reports, for example, the Gross Government Group Committee on Carbon Monoxide reports, any HSE reports. We also looked at relevant legislation sources for the UK as a whole and England, Wales, Scotland and Northern Ireland Pacific, as there are differences in the regulatory and policy landscape between England, Wales, Scotland and Northern Ireland. We then also performed a stakeholders consultation. So this involved semi-structured one-to-one interviews of about 20 to 30 minutes with key stakeholders which were identified. So for this stakeholders consultation, we developed a list of possible stakeholders, sent out invitations, and then had a 20 to 30-minute interview with them. And then using all the information collected, we then performed a gap analysis for solid fuel before using the above information. So this involved using the current available incident data, the current regulatory and policy landscape, and the stakeholders' view to perform a gap analysis. So the gap analysis is basically what the current state of play is, what's the desired state of play, and what do we need to do to get from the current state to the desired state. So I will briefly describe the results for the regulatory and policy landscape for solid fuel. But as I've previously discussed, the focus of this talk is more on the incident data. So we divided this into broadly 4 different areas. So this involves the manufacture of appliances, the safety of appliances, installation, and fuels. There are also a number of various standards, such as BSEN standards, with relevance to carbon monoxide, air quality, and emissions. These are further discussed in the report. So in terms of the manufacture of appliances, this can involve CE marking, which will be replaced in due course by the requirements for the CA marking, the eco-design regulation for stoves, and general product safety regulations. General product safety regulations are also appropriate for the safety of appliances. In terms of installation, this involves the smoke and CO regulations and the building regulations. These building regulations vary between the UK. For example, there's building regulations for England and Wales, Scotland, and Northern Ireland. In terms of the building regulations, these require the installation of a CO alarm in accordance with the standard, where a new or replacement solid fuel combustion appliance is installed. The building regulations also set up the requirements for the location of the CO alarm. For the requirements of the CO alarm positioning, this is summarized in the next slide, which I will present. In terms of the smoke and CO regulations, in England, there's currently been a consultation on extending the scope of the smoke and carbon monoxide regulations 2015. So this would involve amending the approved document J of the building regulations and would require CO alarms to be fitted when installing fixed compliance appliances of any fuel type. In Scotland, there will be a requirement under the Building Act that all dwellings are required to be fitted with CO detection. In terms of fuels, for the air quality domestic solid fuel standards, which have recently come into England, there is currently consultation undergoing in the other countries of the UK. For example, Wales and Northern Ireland, during the time of this project, had a consultation for amending their air quality regulations as well. So as you can see, there is some variation between the different parts of the UK when it comes to regulation and policy. So here is the CO alarm positioning as required under building regulations. So this diagram sets out where the CO alarm can be positioned in terms of your solid fuel appliances. So as you can see, there's minimum dimensions which are required and the locations required. So as you can see from the diagram, this sets out the positions where the alarm could be fitted. So this includes the alarm could be fitting on the ceiling or on the wall, as long as it's within the dimensions specified within the building regulations, which are given in this diagram. So we also done this for the gas sector as well. So as we will discuss, there is some difference between the gas sector and the solid fuel. So in terms of the regulatory and policy landscape for gas, we divided this up into 3 different areas. So there's the manufacture of appliances, installation, and safety. In terms of the manufacture of appliances, this is similar as per solid fuel appliances in the requirements for the CE marking, soon to be replaced in the UK by the CA marking. The installation requirements, which is the building regulations, and the safety regulations. So in terms of the safety, this is where there is the difference between gas and solid fuel. So you have the gas safety installation and use regulations and the radar regulation, which requires the reporting of CO incidences. So this is what I've highlighted below, and is one of the differences between gas and solid fuel, in the fact that gas, you have the requirement to report CO incidences under the radar regulation, which isn't the case for solid fuel appliances. So I will now go on to talk about the incident data. So what we done was we split the incident data down. So we first split it by CO incidents, and then further broke the incidents down by fuel type. So we started, as you can see in this figure, by looking at the number of CO incidents, and then we broke it down by fuel type between solid fuel and gas. This allowed us to kind of follow the chain through to see can we link up the CO incidences between the fuel type, and also to compare the information available between the CO incidences and that which is available for the fuel type. I won't talk about the gas data here, this would be predominantly for the solid fuel. But one key difference between the gas and solid fuel for incident data is that you have the gas incident data for CO from the radar regulation, which isn't the case for solid fuels. So in terms of the carbon monoxide incident data, this is for carbon monoxide data only, but not broken down by fuel type. Data is available from a number of sources. So this includes healthcare providers, the National Poisons Information Service, the Office of National Statistics, the Gross Government Group on Gas Safety and CO Awareness, and also this data is available from the emergency services, which was requested for the FOIs. So in terms of the Freedom of Information Request Act for the emergency services, we requested this information from the police, ambulance, and fire and rescue services. We tried to ensure there was a geographical spread across the UK, and also that services which cover different areas were covered. So for example, if it's predominantly cities to cover, or is it countryside, or is it a mixture of both? In terms of the responses from the emergency services, which I will discuss in later slides, we generally found that we never got much data from the police services. This was generally due to the fact that in terms of the FOI costs, it was not achievable within the acceptable FOI costs for the police to retrieve this data for us. But this is a key finding in itself, in the fact that the data is not easily retrieved for the police. We did find from the fire and rescue and ambulance services, in most cases we got data, but this is also discussed in more detail in a report in which we provide the information for the emergency services and which ones could give us data. So I've just included an example here of the NPIS data. So this actually shows that there is an issue in the domestic settings. So for the NPIS reports for 2019, there was data for 750 unintentional non-fire CO exposures during this year from the NPIS inquiries. In terms of the exposure cases, 40 domestic boilers were responsible for nearly 30% of cases, which was 222 cases. So, and following on for this, between 2015 and June 2019, there were 2,970 unintentional non-fire related CO exposures, which were reported to the National Poisons Information Services. Of key interest is 60% of this exposure occurred in a domestic setting, with faulty boilers the most common source of exposure, which was about 27 to 28%. So this does illustrate the issue with CO, and it is a major issue in the homes for domestic settings. There is further information available in a publication recently published by the NPIS, which the link is below. And there is also publicly available reports for 2019 from the NPIS, which details this in more detail. So the key findings is what we found from the NPIS data was 60% of carbon monoxide exposure could be linked back to domestic service settings. For FOIs to emergency services, this data was only generally available for the fire and rescue and ambulance services. There was a number of potential underreporting, which was which came out of this review, in the fact that the emergency services, there's different reporting for emergency services, i.e. how they report the data. But this I will discuss in the next couple of slides. There was also potential underreporting from ICD-10 codes, which was highlighted. So this is from hospital admission figures, because we did also have data for hospital admissions, which was kindly supplied by NPIS to us. So in terms of the ICD-10 codes, there are different codes which could be used. So for example, there's code T58 that is used. And you could also, under T58, there is X47, which is the accidental poisoning by and exposures to other gases and vapors. X67, intentional self-poisoning by and exposure to other gases and vapors. And Y17, which is the poisoning by and exposure to other gases and vapors of undetermined intent. So, I mean, this could lead to underreporting depending on how the person is reporting the incident. I have included a figure here for the number of CO incident data, but this is only here for information only. It's just here for illustrative purposes to show the potential scale of the CO poisonings. So from all the data we've got, there was 11,451 incidences, but it must also be remembered that from the data we retrieved, this could also involve double counting of some cases, etc. I've only presented this figure to illustrate the issue. So we then broke it down by fuel type. In this presentation, I will only discuss that for solid fuel. So there is a couple of publicly available sources that contain some information. There was the Gas Safety Trust, which is now the CO Research Trust, had an incident database in which 33 incidences for CO and solid fuel were reported between 1996 and 2014. There was a recent abstract for a conference presented by Close et al., which was looking at coroner's data, in which from the coroner's data, it could be seen that 13% of deaths for unintentional CO deaths were from solid or multi-fuel fuel. And that is from coroner's data. There is also data available from the CO and Gas Safety Society, in which between 1995 and 2020, there was 218 deaths from CO exposure from solid fuel. In terms of the solid fuel FOI, the data for solid fuel appliances and CO incidences were only available for fire and rescue services only. We could get no data from the police and no data from the ambulance services. So in terms of how many fire and rescue services who could supply this data, we found from the FOI about 75%. It was about 12 fire and rescue services could supply this data. It is also worth noting that from the FOI request, the ones that we received responses within the time frame of the project were included. We have received a couple more after the project has finished, but this has not made any differences to the numbers, as we have had no numbers reported to us from these FOI requests which were received after the project. So there were some key differences which I will discuss. There's differences between fire and rescue services for how the incidences are recorded and also reported. There is also differences in how these incident data are reported for years. So for example, some fire and rescue services will report by financial year. Some will report the data by calendar year, while others will report a mixture. So in terms of the fire and rescue data, so we generally look for data for the past three years if possible. So from the data we received from the emergency services and from the FOI requests, which were previously performed and supplied to us by the CO Research Trust, was a total of 391 CO incidences from solid fuel. But as per the case for the figure for the CO incidences, this figure is only for illustrative purposes due to the differences in how fire and rescue services have reported and recorded the data. But this just shows the scale of the problem. So we've gone from over 11,000 incidences to nearly 400 for solid fuel. So this table just shows a snapshot of some of the results. So I should also state that as per the FOI request, as I've discussed before, we tried to get a geographical spread to see, could we see if there was issues in certain parts of the country. For example, if there was an issue in those emergency services which predominantly had countryside, for example, but this has not been possible with the data. So this just gives a snapshot of some of the results. This is presented for the fire and rescue services who provided this data in the project report. So for example, the Scottish Fire and Rescue Service reported 34 incidences in 2018-19 compared to 18 in 2020-2021. But as you can see, between these years, there was an increase. So there was no obvious trend from their data. From Med and West Wales Fire and Rescue, we've got 15 incidences from 2018 and 2019 to 21 in the preceding financial year to 20 in 2020 to 2021. They were also able to split the data between injuries and deaths. So in this reporting period between 2018 and 2021, they reported 7 injuries and 1 death. And for Northern Ireland and Shropshire, between them, they've reported 2 incidences in the past 3 years. I've also included in this table the comments which were received, which gives us great insight into the barriers to obtaining the incident data. So for example, the Scottish Fire and Rescue Service reported that the information is manually entered when you suspect an appliance. Northern Ireland Fire and Rescue Service indicated it was a free text which was used for reporting incidences, while Shropshire Fire and Rescue highlighted that the incident reporting system does not report CO specifically. These aspects were also highlighted by other fire and rescue services, which I will discuss in a couple of slides. So what we've done is we've tried to compare between years to see if we can identify any trends. So for this, we've presented in this graph for a number of fire and rescue services. So there's South Wales, Cumbria, Kent, Mid and West Wales, Nottinghamshire, and North Wales Fire and Rescue Services. So from this, we were seeing, could we identify any trends? For example, is there a general increase or is there a decrease? But from the data, it has not been possible to state if there's a decrease or an increase in incidences. So for example, if you look at Nottinghamshire, in 2018, 2019, they reported 50 incidences. They then went down to just over 30 in 2019-20, before an increase to over 60 in 2020, 2021. So they had a decrease followed by an increase, and their numbers reported for 2020, 2021 are higher than those reported in 2018, 2019. So also for Mid and West Wales, as you can see, they reported between 10 to 20 incidences in 2018-19. There was then an increase in 2019, 2020, before a small decrease in 2020, 2021. Whereas you can see for for the other fire and rescue services, such as South Wales, between 2018, 2019, and 2019, 2020, these numbers are similar before a decrease in 2020, 2021. So as you can see, for some fire and rescue services, there's an increase, some between decreases. So in terms of the aspects which have been highlighted, which are barriers to obtaining accurate data. So fire and rescue services have indicated to us in the FOI request that there could be no recording for solid fuel incidences. Information is optional for recording these incidences. Solid fuel appliances are not identified in a coded manner. There's no flag for carbon monoxide in the incident system. So when there's no flag, the numbers which were retrieved for our request were retrieved by a keyword search. So of course, the number of incidences which come back will depend on the keyword search used. There's also been the issue highlighted that free text is also used for recording. So as I've previously discussed, it has not been possible to conclude if the data that we've obtained is representative across the UK due to the differences in both the recording and reporting of the data. And we can conclude that it's very likely that the number of incidences may be underreported for solid fuel. and the number of incidences. I've not presented the gas data, but for the emergency services, it was a similar picture, but this is discussed in more detail in the report. So we also have stakeholder views. So stakeholders also identified a number of barriers to solid fuel incident data for CO. So this included the lack of consistency in data reporting, the need for a centralized record, the need for a possible pathway for both recording and reporting the data, and also the fact the information is optional for recording. So this also tied into what we got back for the FOI request. So for example, the optional recording was highlighted by fire and rescue services, and the lack of consistency in data reporting can also be seen from the FOI request. So we did have potential ways forward. This could include a centralized reporting system, which is electronic, but the key aspect which was highlighted is the figures and output need to be easy to understand, as there will be a wide variety of stakeholders using this. For example, policymakers, the emergency services, associations, etc. So in terms of the regulatory viewpoint for solid fuels, there was mixed views on if solid fuels were suitably regulated. There was a number of areas which were flagged up for concern. For example, the rate of innovation was highlighted as an area of concern. There was also the need for more clarification on the carbon monoxide alarm positioning. And for innovation, one thing that was highlighted was also the changes in the market. So one issue which was highlighted was that of glamping, for example, was how to deal with glamping and CO in terms of the regulations. The responses from the stakeholder consultation also showed that largely the gas industry is viewed to be more regulated and more robust than that of the solid fuel industry. One suggestion which came across was due to the enforcement. So like the gas sector is enforced by HSE and GasSafe, whereas this isn't the case for solid fuels. In terms of that highest risk for carbon monoxide, this has been mainly identified from chimneys, particularly from the draw from a chimney in a domestic setting, and also in relating to chimney maintenance, cleaning, and fuel combinations. So this sums up the gap analysis for the regulatory and policy landscape for solid fuels. So I will just briefly discuss this. So as you can see from the table, there's the current state of play, the desired state, the gap, and the remedies. So the current state is what we found was the regulations may be difficult to follow, the enforcement may be mixed, homeowners may be unaware of the regulations and what is required. Some stakeholders may also be unaware of some regulations. The solid fuel sector is not as regulated and robust as the gas sector, and there is also mixed views on whether the solid fuel sector is regulated sufficiently. So for this, we've suggested some remedies, which I would just briefly discuss for a couple. So for example, for the regulations being difficult, perhaps one remedy could be simplified guidance documents. For the mixed enforcement of regulations, it could be that education and awareness is required for who is responsible for the enforcement of solid fuels. So for example, it's been identified that HSE and GasSafe are involved with the gas sector. In terms of the solid fuel sector not being as regulated and robust as the gas sector, this could involve the need for CO alarms for all installations, and also the enforcement and communication. And also for the mixed views on whether the solid fuel sector is regulated sufficiently, this can involve education programs and perhaps having more focus on the requirements and positions of carbon monoxide alarms. One other gap analysis which we saw was also the fact that for the incident numbers and the requirement under the radar regulations for reporting of CO incidences. So in terms of the gap analysis for the incidents, the current state is there's no easily accessible data for the number of CO incidences from solid fuel appliances. And as you've seen from this presentation, from the FOI request, we had mixed responses in terms of the data which is available. Of course, the desired state is that you'd like this data to be readily available, correct, and not underreported. So some possibilities, which I will discuss shortly, include the possibility of having templates which are standardized for reporting carbon monoxide incidences. And another approach is what I discussed for the regulatory and policy landscape, is also extending radar to solid fuel. There is also no centralized system for incident reporting, so there is a possible need to have a centralized database in which the incident data from the templates can be used. So the key discussion and conclusion points is the solid fuel regulatory and policy landscape is less developed than that of gas. Some potential improvements include extending the radar requirements to solid fuels, the CO alarm positioning and requirements, the enforcement of the regulations, and also a need for education and awareness, and also the need to consider the market. So for example, changing consumer behavior, innovations, and also the demands and the changing of the leisure market. For example, as I've previously discussed, for example, the leisure market with glamping, and also consumer behavior, for example, with COP26, and it could be the move towards solid fuel appliances. So the reporting of incidents is mixed and limited for both solid fuel and CO. There is only a number of limited publicly available sources of data available, and as you've seen, there's different reporting and recording between the fire and rescue services, the solid fuel and CO. So for this, we are unable to state the true number of incidences from CO and solid fuel. But we can conclude there is underreporting, and there is a potential need for standardized data collection template and a centralized database for the recording of solid fuel CO incidences. In terms of future research opportunities, these could include conducting research to ensure that solid fuel appliances work correctly and also remain safe during their working life. There is the opportunities for future awareness raising campaigns. This includes increasing the awareness of the needs and the maintenance of appliances among stakeholders, for example, consumers, and increasing the awareness of potential CO exposure in appliance usage, for example, the safe burning amongst users. And one other key point is perhaps having a proposed roadmap for data collection. So this would involve two stages: the development of a centralized database and data collection templates, which I will discuss in the next slide. So this is our proposed roadmap for data collection. So this, first of all, involves the development of a centralized database, followed by the data collection templates. So the database would first of all involve creating a stakeholder group representing all the relevant groups, consulting with the stakeholder group on what is required for the database, assigning a database host who would then be responsible for the ongoing maintenance, and then developing the standardized templates. So in terms of the data collection templates, this would involve consulting the stakeholder group on the requirements for the templates, i.e. what do they need, drafting templates for recording solid fuel incidents based on consultation with the stakeholders, and then reviewing and testing these templates and amending accordingly. And then the idea would be these data collection templates, when filled, would then feed into the database so that relevant stakeholders could then easily retrieve the data. So I would like to acknowledge the other members of the IOM project team, Alice Smith and Ken Ditson. I would like to also acknowledge the CO Research Trust for funding and also the discussions. And also I'd particularly like to thank stakeholders for the interviews who agreed to give up their time to give their views. And that was greatly appreciated by us. So I'd just like to thank you for listening to this presentation, and I look forward to questions you may have.